Rachael Klein is the Deputy Executive Director of the AIDS Institute, and she is an experienced policy advocate, health policy expert, and nonprofit executive whose tireless voice speaks to policymakers at the highest level of government. Rachael is a policy visionary who brings positivity and humanity to her work. Her passion about social justice, equity, and helping people and organizations work at their best is unparalleled. And Rachael always puts a positive spin on things and tells us what we can do, not what we can't do. So that's why we invited her today, to help us figure out how we can make changes. So, floor is yours, Rachael.
Okay, well, thanks everyone. Although I don't know that I have a lot of positivity to bring us today. So you're going to have to excuse me from that part of it, but I will leave you with some action steps and some things that everybody can do. So Lauren asked me to give a federal update about what's going on in Washington and specifically about what is going to be the impact for hepatitis programs and obviously for Oregon as well. So I guess I'll just start by saying it's been a busy year. There has been a lot happening, some of which we anticipated, much of which none of us could have anticipated coming in to 2025. But I think all of us will be a little bit relieved to have a bit of a break for the holidays and to say goodbye to 2025. Because a lot of what's been happening, especially when it comes to healthcare, has not been good. And we have spent a lot of this year fighting against attacks that are, really seeking to cut the programs that folks rely on for access to care and to reduce the amount of federal spending on healthcare and other social needs programs. And a raft of both legislative and regulatory proposals that will result in a lot of people losing access to healthcare coverage. I want to start, I can go ahead, I think, and share my slides if that is helpful. Do I have the ability to do that? No, I cannot, it says. So I can also just send these later. I don't think there's any magic in them. I'm going to talk a little bit about where we are with the appropriations process. I'm going to talk a little bit about where we are with some changes to the Affordable Care Act and coverage that it provides. Talk a little bit about what's going on with Medicaid and what to expect in the coming year. And then what the implications are for our programs and what we can do to help mitigate the damage that has been wrought this year. So let's start with appropriations. Okay, we're basically nowhere with appropriations. Short and sweet. There's a lot of talk and very, very little action. I think, after the government shutdown when was that? September, October. Everyone came back. There was a continuing resolution that extended fiscal year 2024 funding through January of 2026. So, I guess 2025, 2025 funding through January of 2026. Apologies. I'm getting on my ears, although frankly, the extension of 2025 funding is an extension of 2024 funding because we did a CR last year too. So we're really just sort of moving forward, level funded for the most part, with our appropriations. I think we may even be working with 2023 budgets at this point for 2026, because Congress has not been able to come together on any kind of budget bills in quite some time. There's been a lot of conversation going on about whether or not we might see a couple of the budget bills for FY26 get passed this year before the end of the year. You may have heard people talk about a minibus, which is basically just a couple of the package. There's like 12 or 13 budget bills that need to pass in order to make up the whole of the federal appropriations process. And so the question was, could we get a couple of them done that some folks thought might include the labor HHS budget, which is where all of our health programs live, funding for all the programs that the Department of Health and Human Services administers. So at this point in time, it does not look like that's going to happen before the end of the year. Could that happen in January? Yes, it's possible. There's still a lot to work through before we can probably get to that vote. But, if Congress decides that it's important to pass those bills, then, they can always get their act together and they can pull a rabbit out of a hat and they can make it happen. What would it mean if those bills passed? The bill in the Senate that has made it through its appropriations committee essentially is level funding. So the good news there is that we wouldn't be seeing any further cuts to the discretionary part of the federal budget. So all of the HIV programs, all of the hepatitis programs, STD programs, TB, et cetera, that are run through the CDC would continue to be funded at current levels. The House bill actually had a small increase for hepatitis programs of $10 million. But it also included substantial cuts to a raft of other programs, and especially to HIV programs, which are, I think it's over $1 billion that would be cut from the HIV program. So altogether, about 25% of the amount that the House is proposing to cut from the social and human needs programs would come from the HIV space. So we are not advocating, despite the fact that it does include this $10 million increase for hepatitis, we are not advocating for that House bill. If that bill were to move forward in the House and the Senate were to move forward its bill, we would be in a situation of coming together to talk about, what is the final bill? Because as you know, we would have to conference them and come up with one appropriations bill for that, for HHS. And at this point, and what has happened in the past is that the Senate numbers have generally prevailed. And so the budget that we're working with now is an extension of essentially what was in the Senate budget for FY25, FY24. And so basically what we are expecting to have happen is that those bills may or may not move forward and be voted on individually, or they might pre-conference and come to some sort of an agreement so that one bill goes through both chambers. But our hope is that that bill ends up looking more like the Senate bill than it does like the House. We are still very, very concerned that the House is continuing to propose such dramatic cuts. And so we want to make sure that we're continuing all of our advocacy now through the holidays into January until something is actually voted on to make sure that we can keep the numbers as high as possible for that suite of programs that we all care about so much, and for all of the discretionary health programs. So that's what we're going to be basically asking for, is that the ultimate, whatever they ultimately do, they keep it as close to the Senate as possible. And that's what we've been asking folks to talk about with members of Congress. And we still need to keep very loud about that, because as soon as we come back in January, we have to finish up this fiscal year 2026 appropriations process, and then we've got to head right into 2027 with really none of the larger debate that Congress has been having about how much money the federal government spends on healthcare resolved. And the administration continues to have its proposal to restructure the Department of Health and Human Services, which would involve consolidating the programs for at least for hepatitis, TB, and STDs into what they've referred to as a block grant. And that could have some very significant consequences over time for the amount of money that's available from the new administration for Healthy America, which is what the administration is proposing to do, is to sort of break up the CDC and consolidate programs from HRSA and the CDC into this new AHA, Administration for Healthy America. Congress has not signed off on this proposal, but the administration's budget is likely to reflect it because that's what they did this year. And they, I think, fully intend to move forward with or without Congress's blessing to at least consolidate CDC and HRSA into a new administrative structure of some sort. So I think we should expect to see more cuts coming out of the administration, more cuts coming out of Congress, proposals to cut these budgets in FY 2027. And all of these battles are going to be continuing. So they kind of all blur together, but the important point to remember is that we all need to be making phone calls and talking to members of Congress and urging them to maintain funding for the programs that we care about because they are so vital. And we have to do a lot of education too, right? Like the folks who are staffers in Congress don't really understand how all of our programs work. And there's a lot of turnover in Congress, and especially among the staffers, and a lot of folks who don't have historical knowledge anymore about what the Ryan White program is, what the hepatitis programs are, how they operate. So it's really, really important for us to keep up that education and keep up our requests all year round these days. So that's my update on appropriations. And we'll have to sort of, wait and see what January brings and continue our work. But, other stuff is continuing. If you guys recall, the reason that the federal government, one of the reasons that the federal government was shut down in September, October, is because of the impending end of enhanced premium tax credits for Affordable Care Act coverage through the marketplace. And what that means is that for health insurance programs for that will start, health insurance plans that will start January 1, 2026, the amount of premium tax credit that people are able to get to help them afford those plans is going back down to the levels that it was at before 2021, when there was an enhancement that was included that got a lot of extra money into people's pockets to afford the high premium costs for marketplace coverage, because we were in a time with rising costs. People were really struggling to meet the cost of living, post-pandemic era, lots of inflation. And none of that's actually changed, right? We're still in a position where costs have been going up. Families are struggling to make ends meet. They're having trouble with higher and higher housing costs, higher and higher costs of food, and many, many other daily goods. And so we have been advocating for an extension of that enhanced premium tax credit because it helped so many people gain coverage in the marketplace. And of course, the loss of the enhanced premium tax credit means people will have to pay more even if there weren't any changes in the amount of the premium cost for health insurance plans. But of course, because of the loss of in part because of the loss of that enhanced premium tax credit, and because healthcare costs continue to rise, premium costs are going up. So people are facing now, who are shopping in the marketplace, are looking at health insurance plans that have an increased premium over what the premium was last year, and they're getting less premium tax credit. And on average, across the country, people are looking at health insurance premiums that are about double what they have paid over the past several years. And we're very concerned about that. The Democrats in Congress urged there to be a vote to extend those premium tax credits as part of the appropriations process for FY26. And when that didn't happen, that's one of the reasons that the government ended up being shut down, because without that provision being included in the budget bills, they were not able to get to the 60 votes required in the Senate to vote on the appropriations process. So they ended the shutdown, moved forward with the appropriations process, but didn't vote on the Affordable Care Act premium extension. We now expect there to be a vote in the Senate on Thursday of this week on a 3-year extension of those enhanced premium tax credits. The thing that the Democrats won in their shutdown exercise was getting that vote on the Senate floor. So that is supposed to happen this Thursday. We do not expect that it will necessarily pass. There was an agreement to bring the vote to the floor. There was not an agreement that Republicans would vote for it. And of course, there was no agreement about getting a bill onto the House floor. There is an effort to bring a bill to the House floor that Democrats have been urging their fellow colleagues to sign what's called a discharge petition. And I think they need 4 Republicans to sign on as well in order to get enough folks to force the speaker to bring that vote to the floor. So far, they haven't gotten that. There's a lot, but that said, there's a lot of pressure on all members of Congress in the House and the Senate to do something to help people with their healthcare costs next year. So the Republicans have been talking about a lot of alternatives to extending that premium tax credit enhancement. And most of them are things that I personally do not believe would help the situation. And most of them have nothing to do with lowering the cost of the premiums or helping people to afford the premiums on their monthly health insurance plan. So at the moment, it looks like we continue to be at a stalemate on that issue. But because of that pressure, we are starting to at least hear the conversation happening on both sides of the aisle. And the Republicans are trying to figure out what they can get members to agree to vote on. We'll have to see what happens with that. I think it's unlikely that we will again see a resolution of this issue before the end of the year, which means it will go into January. Open enrollment is going to end on January 15th. And of course, December 15th is an important date because people have to choose their plan and pay their premium by December 15th in order to have coverage that starts January 1. So extending this into beyond this week is really not great. But there are reasons that we still think it's important to continue working on this into January, into February, and for the rest of next year if we have to. If Congress at some point does decide to extend those enhanced premium tax credits, then there can be another open enrollment period. There can be other fixes that would happen. And so we want to keep up the pressure. And this week, you are probably hearing from a lot of different folks and sort of let's get the word up there. Let's make a lot of calls to members of Congress because we need them to hear from their constituents that this is important enough that they need to move the dial. They need to take some action. And so there are a lot of different organizations that are doing days of action this week and next week. And if you have heard about those, that's fantastic. If you haven't, that's okay. All they're really saying is pick up the phone, call your member of Congress, Democrat or Republican, but particularly Republicans, and let them know that this is a really important issue. And that's probably the thing that we can do to, that's most important is make our voices heard. It's also really important for people who are experiencing these rising costs personally to be sharing their stories. And, talking with reporters or sharing on social media or sending their story to their elected representatives just to say, hey, this is real and this is happening to me. And it's going to mean um, some really tough things for our family. We're either going to have to struggle to afford these new costs and therefore be struggling even more with our housing and our food and getting shoes for the kids, or we're going to have to put our money to those other costs and maybe skip on our health insurance this year or buy a plan that's less expensive and doesn't meet our family's needs. And getting those stories out there is really, really crucial because it makes a huge difference when people can hear that firsthand. So I still have hope that this can happen. I do think that that it is an important thing for Congress to be addressing. The sooner the better, but as long as it hasn't been addressed, the conversation continues and it gives us an opportunity to talk about how healthcare is unaffordable. And the reality is, even um, when you can afford to buy a health insurance plan, chances are pretty good that those out-of-pocket costs, especially if you have a serious condition that requires a lot of healthcare, are still really hard for your family to afford. And that's the kind of conversation that we need to be really elevating so that Congress feels the need to do something both about the cost of coverage and the cost of the care when you have coverage. And so you'll be hearing a lot more from us and probably from others about that as well. Okay, let's move into the probably running out of time, but I do want to talk a little bit about the Medicaid cuts that happened earlier this year. They are going to start to go into effect in January 2027. But that doesn't mean that we get to wait until 2027 to do anything about it. States and the federal government are right now trying to figure out how to implement all of those cuts that happened in that reconciliation bill. States are going to start to feel the pinch of this because there's going to be less federal money flowing to states through the Medicaid program because of cuts to the provider tax, which is a way that states come up with their own state match in order to draw down federal dollars for Medicaid, and restrictions on state-directed payments, which are specifically usually around managed care plans, right? They are payments that states make to provider entities to encourage them to provide certain kinds of care. And there's restrictions on both of these funding mechanisms that were enacted in HR 1, and that means that states are going to be getting less money for Medicaid, which is going to be really challenging for state budgets because Medicaid is one of the top things that states spend their money on. And in addition to that, there are new restrictions that are being applied to state Medicaid expansion programs. So states like Oregon that have expanded Medicaid are going to have to implement this new work requirement program. And your state is already working to try to figure out how that's going to work. And there are a lot of important decisions that need to get made about what counts as community engagement. It's a community engagement requirement that people have to be working or going to school or volunteering at least 80 hours of the month. Uh, and states have some options about, is that 1 month or is that 3 months or is that 6 months? How many months during an eligibility period do we need people to be complying with this work requirement? And how are we going to, what counts as community engagement, and how are we going to prove that people are and document that people have been engaged when they're subject to this requirement? And it applies to all adults 19 to 64 who are in that Medicaid expansion program, unless they are exempt because they meet one of what's a relatively long list of exemptions. And included in that list of exemptions is people who are medically frail and or who have special health care needs. And that includes people who have serious and complex chronic illnesses, but that isn't defined. So it's going to be up to CMS and states to figure out what counts as having a serious and complex chronic illness that would exempt somebody from that Medicaid work requirement. And so, we are working with advocates and hoping that everyone is working with their state agencies to try to make sure that the rules for how that work requirement is implemented and the rules for exemptions are implemented in a way that maximizes the number of people who are exempt and minimizes the burden on people to prove that they've either met the requirement or that they're exempt. Importantly,
Rachel,
yes.
that is actually a segue to our next speaker, who's going to talk to us from OHA about Medicaid and the cuts.
Fantastic. So I can stop talking about that now?
Yeah, we are going to bring him
Okay.
up. And can you hang out for a few questions and answers after this?
I sure can hang out. And also, I just want to say thank you to everyone. Sorry if I took too long. And, make all the phone calls.
Thank you, Rachel. We appreciate it.